We now shine the spotlight on a youth initiative in the healthcare sector. The Zodwa Khoza Foundation has announced the deployment of 400 beneficiaries to the Chris Hani Baragwanath Hospital. For more on this, let's unpack this further with the Zodwa Khoza Foundation Chairperson, Sonono Khoza. She joins us now live via our video link. Thank you so much for joining us for this conversation, Sonono. Let's start off here. You've selected at least 400 students, and they will be part of this program, and they'll be getting an internship from the Chris Hani Baragwanath Hospital. Firstly, tell us more about this program and how they were selected.
Thank you very much. I'm happy to be here, and good evening to the listeners. The beneficiaries that we have an extensive database of over 5,000 beneficiaries. So through that, there was a need for them to get an on-the-job training, because what we started with our job readiness training, where we're giving them, the tools of how to assist them when they get into gainful employment. And then we went into a partnership with the Gauteng Department of Health, who were happy to allow us to test and come up with an idea of getting our youth to get that on-the-job training, and also assist them get skills so that they can also be able to get permanent positions as well.
And let's talk about these skills that they will obtain. And one would say on-the-job training, very important in terms of trying to bring young people into any workspace. This program, what type of skills will they be getting, and what will be the focus areas?
The focus areas, as we agreed with BARA, they've placed them in, they needed porters. As you understand, there's a huge backlog at all the hospitals, but BARA has a huge backlog in the laundry as well. There's also admin, and the others are going to be tending the grounds. There's just a lot. There's porters as well. So there's a lot of programs that are going to be introduced.
And as the Zodwa Khoza Foundation, how important is this on-the-job training for the 400 young people you've selected?
Yeah, it is very important, because when you look at the stats, we have those that are not in employment, education and training. We are sitting at over 3.5 million young people. In those, more is more women that are actually impacted and affected. So we are sitting with a pandemic of high unemployment in our country, and it takes all of us, to put our best foot forward to come with solution. It's not best solutions because there are naysayers, and there'll be people that are going to be poking holes and not understanding that we have kids that are sitting at home. There's also that whole understanding that South Africans don't want to work. You'll see our beneficiaries, the passion and the dedication that they are showing. They are hungry for opportunities. So we saying this as a start, it can be rolled out in other areas where there's a need, because we need as a country to push volunteerism, because volunteerism is the one that's going to take us out of the quagmire that we are currently facing. Our cities are rotting. Kids are sitting at home. We have high unemployment. There's drugs and substance abuse issues, because kids don't have, they don't know what to do with their time. So if we can get those kids to work and contribute gainfully, it also boosts their confidence, and also helping us, win our cities back, our hospitals back, and our country back.
And Sonono, how is the health department, assisting you in this regard? Because I understand that you are working hand in hand with the Department of Health.
Yeah, we have entered into a memorandum of agreement, and they are assisting by allowing us to bring our beneficiaries into the hospital. We're starting with BARA. When these 400 with the assistance of the funders that have come on board, as soon as that funding gets released, we are hoping to grow it and maybe hopefully go to other hospitals and also maybe go nationally as well, because the need is far and great. We have a greater need for on-the-job training and the skills development.
And before I let you go, I mean, when it comes to this on-the-job training that they will receive, what happens after? Are they guaranteed any form of employment?
There are a lot of posts that are unfilled currently in our hospitals. So we are hoping those that stand out after they've received the training, after they've also received upskilling, they will also be considered. We are hoping, and we have made that clear to the department, that those that actually stand out, that put their best foot forward, they should be considered for permanent positions. But it's not in our hands. We can only just make a plea, and also if there is willingness on the side of the powers that be, we could maybe make a dent in this high unemployment rate that we are currently facing as a country.
All right, Sonono, thank you so much for your time. That is Sonono Khoza, the Director and Leadership Management for the Zodwa Khoza Foundation there.